Hello everyone, good morning everybody. I am Sanya, your host from All About Skin Wellbeing. I am sure all of you must be keeping good health. We all know taking care of skin is important for more than just your appearance. As the largest organ, your skin becomes the most essential to your overall health. A fungal infection is very common on your skin or nails. Fungal infections or mycosis are diseases caused by a fungus, yeast, or mold. Mild fungal skin infection can look like a rash and can be itchy and annoying. So let's connect today with our skin expert, Dr. Aruna Pawar Suryavanshi. She is a dermatologist, cosmetologist, and trichologist and has an experience of over 9 years in this field. She has completed her graduation from Government College Pune and post-graduation from Mumbai. She has experience of working in both government hospitals and private hospitals as well of skin. Some of the services provided by her are anti-aging treatment, trichology, skin allergy treatment, skin allergies and wrinkle treatment, etc. Dr. Aruna Pawar Suryavanshi, a very warm welcome on our live session.
Yeah, hello.
And as we are going to discuss about a very important topic, that is fungal infection. And as we all know that in India, monsoon have already come, and we have seen that in monsoons, in rainy season, the climate is humid, and due to that also, many times people have the problem of fungal infection of different types. So we are going to discuss about the fungal infection, and when we are talking about fungal infection, the most important question, which comes in our mind is what is basically fungal infection and how we can define fungal infection, doctor?
Yeah, so basically, a fungal infection is nothing but a superficial infection by a dermatophyte. So basically, in Hindi language or in Marathi language or in English language, any language, there are the different names and terminology for that. So in Marathi, someone calls them as a burshi, or in Hindi, buri, or in English, athlete's feet or jockey itch. These are the common names, and many more like this. These are very common in India.
Right. And when we are talking about fungal infection, sometimes people are searching for the reason as well, and they don't know is it really the fungal infection or not. So when we are talking about fungal infection, what are the causes, or why it occurs? What are the reasons people have fungal infection?
Yeah, so basically, it's very important to know the cause because nowadays over-the-counter medications are very common, and people are going to the medical and purchasing the different kinds of medication to get a relief. Okay, so very important to know the cause. Basically, in India, what happens due to overcrowding and due to civilization, urbanization, there might be a lot of overcrowding. We can say in case of Mumbai, Pune, or likewise metropolitan जो सिटी है वहां पे बहुत ज्यादा ओवर क्राउडिंग होते, पीपल आर लिविंग इन वेरी स्मॉल एरियाज, वेरी क्राउडेड and more to more skin contact. So fungal infection may cause due to, there are different ways. Okay, so human to human contact may be there, from animals to human contact may be there, from soil to human, this is rare actually. So and from the object to human. So these are the various paths from the fungal infection get occur, but we have to go why it occurs and in whom especially fungal infection is more common. So in case of people who are sweat more, or ऐसा working हो गया है कि in IT profession they are working from 8 to 9 hours continuously, and people are traveling for the job and anything from very long distances. In Mumbai, you are seeing that people are traveling through the trains and there is overcrowding बहुत ज्यादा है. So likewise their water logging बहुत ज्यादा होता है, बहुत ज्यादा sweating होता है, तो fungi has an affinity to the humidity and water logging and sweating. So what they do, they actually invade your skin, they breaks your superficial part of your skin, and where water logging or sweating बहुत ज्यादा होता है, and it's a favorable environment to fungi to grow. So basically वो avoid करना चाहिए. So for that it's very important to know the cause.
Right, definitely. And as you said in the starting, that self-medication is most of the people priorities. That some of the powder or some skin, cream affects our friend, and she or he suggested that thoda sa aap ye laga lijiye and it will be fine. So we definitely go through that, and we find that more easy, and that going to a doctor and is better than applying cream. But that was doctor is saying that it can worsen your symptoms, and you should definitely refer to a dermatologist if you are having any kind of fungal infection. Doctor, when I was telling about the symptoms, we really want to know that how can somebody identify that this particular thing is fungal infection? What are the various kind of symptoms which occurs during fungal infection?
Yeah, like I have previously said, ki most commonly they are called as ringworm. But basically, this is not due to a worm. This is a fungal infection due to a dermatophyte. So basically, the rings, people usually see a rings on their skin or all part of your body, and basically they lies where the sweating is more, where the areas are closed and their folds are more, like we are seeing over the face also, or in the axilla also, over the genitals also, in the folds of thighs also, underneath the breast also. So there are the circular. So in scientifically call them as these are the erythematous plaques, and basically having the active border, the red border, and the center clearing is there. So due to this appearance, na, they are the misnomer is like that. They are calling them as a ringworm, but basically I like to let you know that this is a dermatophyte infection. This is a fungal infection, not because of any kind of worm. And basically, the patient is having the lots of itching as soon as the sweating and this worsen na, so the itching and redness is in we are seeing in the active part of infection. And likewise, over the period of time it becomes a hyperpigmented or black, along with the colors of the skin. Like in fair individual, we are seeing the very red and erythematous rashes, and in dark skin patients we can see the hyperpigmented or dark color patches.
Okay, so these are the various kind of symptoms: round rash, as you have mentioned, a ring like structure, and itchiness. And we have seen in monsoon, because we are out, we are having a raincoat, we are moving out, humid climate. Is it like that? In monsoon, people should take care more of themselves of fungal infection. Is it like that? In monsoon season, people are more prone of getting fungal infection.
Yeah, I previously said humidity favors the to multiply of fungi to grow. So in rainy season, the weather is already humid. So likewise, the fungi will grow very fast and very quickly. And we should avoid the contact, like human to human contact, from objects to human contact. We are sharing the soaps, we are sharing the towels. Actually, we are like share clothes are not washed properly and regularly. If they are washed, they are not properly dried. Okay, so likewise we have to take care of that to maintain our clothes very we have to wear fully dried or iron clothes regularly, yeah, and avoid contact as possible.
Okay, doctor. And as you said, we have to avoid contact, to human, and objects also can be a cause of fungal infection. My next question is that is fungal infection contagious? If somebody is having fungal infection, usually when we see someone, scratching their hands, or we see some kind of redness on their hands or skin, we usually are far from someone. So is it like that fungal infection can spread from one person to another if by mistake, in train or in bus or anywhere, we have just in contact with that person?
Yeah, like previously I have mentioned the path, how it spreads. So human to human contact, object to human contact are most important. And yeah, I generally advise, so we as a dermatologist we advise to the patient to cut a nail short, because क्या होता है कि कहीं पे यहाँ पे itching है and patient is scratching a lot, and other जगह पे अगर हाथ लग गया है तो through the nails also it's spreading a lot. So yeah, it's important to know कि ये spread होता है human to human and because of sweating all over the body. अगर किसी को एक ही पैच है और they are getting spread very easily and very quickly.
Okay, so it can be spread from one person to another if you don't take care of yourself. And as doctor have already mentioned, if you have big nails, please cut them down because it can definitely spread from one person to another. Doctor, we have talked about what is basically fungal infection, what are the causes, what are the symptoms. But when we talk about the management or the treatment of fungal infection, what are the various kind of treatments which are available for fungal infection?
Yeah, so basically the management is very very important in such cases and please don't self medicate yourself कि मेडिकल में गए या फार्मेसी में गए, ऐसा नहीं है कि उनको नहीं पता है बट एटलीस्ट क्या प्रॉपर स्किन एनालिसिस होना बहुत जरूरी है. सो वी शुड अप्रोच अ डर्मेटोलॉजिस्ट, सर्टिफाइड डर्मेटोलॉजिस्ट और उसके बाद प्रॉपर स्किन एनालिसिस करके फिर वो देंगे कि आपको क्या मेडिसिन आर इम्पोर्टेंट. सो इन द मैनेजमेंट पार्ट ओरल medicines and the topical medicine both are important. Oral medications में अजोज ग्रुप के जो ड्रग्स है वो ज्यादा हम यूज करते हैं, तो ऐसा मैं स्पेसिफाई नहीं करूंगी क्योंकि वही होता है फिर पेशेंट जाके फिर सेल्फ मेडिकेट करते हैं एंड दे डोंट नीड अ प्रॉपर कंटेंट बिकॉज ऐसे फॉर्मुलेशन भी होते हैं जिसमें अजोल्स एंड द अदर स्टीरॉइड्स एंड अदर कंटेंट नाम के भी कोई ट्रिपल कॉम्बिनेशन वाले क्रीम्स भी रहते हैं. उसमें पेशेंट को सिर्फ एक कंटेंट दिखा कि नहीं 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 ये तो बोला था कि ये डॉक्टर ने बोला था कि अजोल ग्रुप यूज करते, तो दे आर सेल्फ मेडिकेटिंग themselves. और दूसरा ये है कि ये जो हम मेडिसिन लेते हैं दे आर क्वाइट उनका प्राइस थोड़ा सा ज्यादा रहता है, वो कॉस्टली रहते हैं, तो पेशेंट सेल्फ मेडिकेट ना करे ताकि प्रॉपर एनालिसिस करके पूरा समझ लेके कितना कोर्स होता है. सो ड्यूरेशन 3 weeks to 3 months होता है. उसके साथ प्रॉपर हाइजीन और मैंने जो जैसे बोला है वो भी मेंटेन करना बहुत इंपॉर्टेंट है. और टॉपिकल फॉर्मुलेशंस भी बहुत वेरिएशन है. कुछ पाउडर्स रहते हैं, तो टिपिकल अजोल ग्रुप के पाउडर्स रहते हैं, किसी में कॉम्बिनेशन विद स्टीरॉइड्स रहता है. अभी बहुत आगे भी हम लोग उसके बारे में बात करें कि स्टीरॉइड से बहुत पेशेंट को जल्दी रिलीफ मिलता है बट दिस इज द नॉट फॉर द लॉन्ग टर्म. सो व्हाट यू कैन डू, गो टू द डर्मेटोलॉजिस्ट, अ प्रॉपर स्किन एनालिसिस शुड बी देयर एंड देन व्हाट प्रिस्क्राइब फॉर हाउ मच ड्यूरेशन दे आर प्रिस्क्राइबिंग, कंप्लीट द कोर्स. इट्स वेरी इंपॉर्टेंट टू कंप्लीट द कोर्स क्योंकि क्या होता है पेशेंट का कि इनिशियली इन 8 days पेशेंट में गेट अ रिलीफ, तो उनको क्या लगता है कि नहीं अभी चला गया है तो मैं मेडिसिन स्टॉप कर देता हूँ. फिर उसके बाद रिकरेंस बहुत ज्यादा आता है, पेशेंट को रिपीटेडली इन्फेक्शन होता है, फिर उनको लगता है कि नहीं मुझे ही क्यों है, क्या मैं हाइजीन मेंटेन नहीं कर रहा हूँ कि क्या. लेकिन बेसिकली हाइजीन भी इम्पोर्टेंट है, उसके साथ में प्रॉपर ड्यूरेशन ऑफ द कोर्स और प्रॉपर ट्रीटमेंट लेना भी बहुत ज्यादा इम्पोर्टेंट है. सो प्लीज गो टू द डर्मेटोलॉजिस्ट एंड get your skin analyzed and then start the treatment and complete the course of your treatment. And in such cases follow up is very very necessary. So we'll see.
Right, definitely. So, as doctor said, do not self-medicate. And I think we use a lot of social media platform now, and I think there are a lot of treatments which are available for different fungal infection, and people usually use it, and then they see that it is not happening. So then they go to a dermatologist. But if you see any such kind of infection or any such kind of itching is happening to you, do go to a dermatologist because they know how to treat it well. And as doctor have already mentioned, do not your course should be completed. Do not left it untreated because the fungal infection can reoccur. Doctor, you have mentioned about steroids for the fungal infection. So what are basically the role of steroids for a fungal infection, and is it good or bad for a fungal infection? If someone is having fungal infection and he or she is taking steroids, so what is the advantage and disadvantage of steroids in fungal infection?
Basically steroid are not a bad drugs actually, because जब severe cases होते हैं और बहुत सारे other conditions of skin and in any part likewise. So we are steroids are called as life saving drugs. Okay, life saving medicines they are. So ऐसा नहीं है कि steroids बहुत ही यूज ही नहीं करना चाहिए, लेकिन क्योंकि ऐसा होता है कि पेशेंट फिर सोचते हैं कि नहीं 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 फंगल के लिए मैम ने नहीं बोला था, ये डॉक्टर ने नहीं बोला था, तो इसके बाद में स्टीरॉइड्स को भी यूज ही नहीं करना है. लेकिन डिपेंडिंग अपॉन द सिवियरिटी अदर देन द फंगल इन्फेक्शन आई एम टॉकिंग अबाउट, कि अदर स्किन कंडीशन में एक्जिमा सोरियासिस इन केसेस में द स्टीरॉइड्स आर playing a very major and important role. But this is the fungal infection, इनमें स्टीरॉइड्स का कोई यूज नहीं है. बेसिकली क्या होता है कि स्टीरॉइड्स के लेने के बाद या उसको लगाने के बाद पेशेंट को इमीडिएट रिलीफ. ओके, एंड दे जस्ट रीडिंग द या ये क्रीम से डर वो बहुत सारे लोकल नाम रहते हैं उसके. तो फिर पेशेंट जाके मेडिकल में से परचेज करता है, वो लगाता भी है. उसके बाद क्या होता है ना, जो एग्जैक्ट मॉर्फोलॉजी रहती है, जो एक्टिव डिसीज की होती है वो भी जाती है, उनको रिलीफ भी मिलता है कि नहीं नहीं मेरा इन्फेक्शन गया. जैसे आपने स्टीरॉइड छोड़ा ब्यूटो विड्रॉल, और उसके बाद फिर इतना आता है कि जब आप डर्मेटोलॉजिस्ट के पास जाओ भी तो भी प्रॉपर एनालिसिस कभी कभी नहीं हो पाता क्योंकि पूरा मॉर्फोलॉजी चेंज हुआ होता है. तो फिर ऐसा है कि इसीलिए डायरेक्टली जाके या फार्मेसी से लेके आप स्टीरॉइड्स ना यूज करें. बेसिकली आप गो टू द डर्मेटोलॉजिस्ट एंड उसके बाद फिर क्या यूज करना है, कैसे यूज करना है वो इम्पोर्टेंट है. बेसिकली स्टीरॉइड्स आर कॉल्ड एज लाइफ सेविंग ड्रग्स. तो ऐसा नहीं है कि उसको कहीं भी यूज नहीं करना है. और बहुत सारी सीवियर केसेस रहते हैं जहाँ पे अदर देन द स्किन अदर ब्रांचेस में भी वो बहुत ज्यादा यूज होता है. लेकिन ऐसा नहीं है कि फंगल इन्फेक्शन में इसका कोई यूज नहीं है, तो जस्ट जाके उसको परचेस ना करें.
Yes, so if you want to treat yourself with a steroid, first you should refer to your dermatologist, and then he or she will suggest that it is good for you. Then only steroids can be used very well.
In case of fungal infection, it is not good.
Yes. So very well explained, doctor, that how steroids, because it is the time that people are in a hurry, so they feel that जो भी चीज से जल्दी इलाज हो जाएगा, that is good for them. So that's why they do it. But it is always preferable that you go to a dermatologist. Doctor, we also have some live viewer questions who are watching this live. So they also have some questions for you. John is here and he's asking, can I still participate in outdoor activities during the rainy season if I have a history of fungal infection?
First go to the dermatologist and start the proper treatment and complete the course. You can participate the outdoor activities, but I am advising the patients also who they are doing the outdoor activities or playing some games or doing the gym. After the activity, you have to take a bath properly and use a light wear clothes, and also your gym wear should be a very light, so that you can they should be washed regularly, and they should be dried properly.
Okay, so we have mentioned the clothes. The clothes play a very important role in fungal infection. Do they?
Because we generally advise to the patient to wear a light clothes, because as I already mentioned, cloth objects to human contact is also there. So if you are sharing a clothes with someone, if he or she already having a fungal infection, so it is the best way to transmit it. And if you are wearing very tight and very sweaty clothes now, so it will increases the sweating and the water logging, and so because of that in close areas in axilla you are getting the same infection. And due to a scratching, because the itchiness is quite a major part here, and so we are itching and scratching a lot, and so that the infection gets spread easily.
So it can be transmitted from different parts, as we have already discussed. So cloth is a major thing, and it can be definitely transmitted. Doctor, we have Itisha Kaushik here and asking, are there any natural remedies or home remedies that can help prevent fungal infection during the rainy season?
Okay, likewise, I said, please don't change the morphology of disease. So to do a proper skin analysis, go to the dermatologist. At home, what you can do, you can wash your clothes separately, you can completely dry them, you can iron them, use light wear clothes, and after gym wear, you have to maintain a proper bath twice. Then immediately wash your body after a gym or after a heavy exercise or something. like that. Complete the course, applied medicines properly. These home things you can do at your home, but don't try home remedies. Please go to the dermatologist.
Okay, so don't try home remedies at home, and instead of that, go to a dermatologist and treat your fungal infection well. And because it is very important that whatever fungal infection you are having should be rightly and properly treated. Doctor, we also have our next viewer asking, Shania is here asking, should I avoid contact with pets or animals if I have a fungal infection?
Yeah. Basically, on the human body, also on the animal's body, there is fungi. They are considered as a natural barrier to skin, but due to increased sweating and due to waterlogging, they try to invade your skin. ओके सो ऐसा नहीं कि एनिमल्स के ऊपर फंगा नहीं रहता या हमारे ऊपर भी फंगा नहीं होता. दे आर कंसिडर्ड एज अ नॉर्मल फ्लोरा ऑफ योर स्किन. नेचुरल जो स्किन बैरियर होता है उसके ऊपर दे आर कंसिडर्ड एज अ नेचुरल फ्लोरा. बट बिकॉज ऑफ दिस थिंग्स ना, बिकॉज ऑफ द एनवायरमेंटल कंडीशन एंड योर increase sweating, there are chances to get you infect easily and you are transmitting the infection to the others also. So basically, yeah, the animals, so the animals to human contact is also there. So we can't check whether they are having a fungal infection or something. Their symptoms and their morphology features may be different from us. But yeah, the animals to human contact also should be avoided.
Okay, so if you have fungal infection, you should really avoid getting in touch with the pets or animal. Doctor, when we talk about the fungal infection, so if somebody is having fungal infection, what are the do's and don'ts one should definitely follow if he or she is having fungal infection?
Yeah, so take a bath wisely. Use a separate soap or smaller soaps. I generally advise to the patient, so you can use a body wash or jet wash because it can't be shared in 2 to 3 people, and body wash can be you can share. But yeah, and wash your towels also regularly, dried it properly, and then you can use, because you know na, the towels itself contain moisture, and so there जहाँ पे भी आपको जहाँ गीलापन या वेटनेस जहाँ पे है ज्यादा, तो वहां पे ज्यादा इन्फेक्शन स्प्रेड होने के चांसेस है. सो dry your towel also the regularly, and your clothes should be washed properly and separately. They should be ironed, they should be dried, and then you can wear. So generally use of light clothes we are advised. Gym wear should be washed properly, they should be dried and then used. They should be washed regularly and routinely, not कि ऐसा नहीं है कि वीक में 2 ही बार वॉश कर लिया. फिर वो भी है कि वो प्रॉपरली वॉश करना जरूरी है. फिर उसके बाद हम पेशेंट को एडवाइस करते हैं कि ये सब भी है कि क्लोथ्स का आपने कर लिया, टॉवेल्स का कर लिया. फिर जिसपे भी घर में ये बहुत ज्यादा कॉन्टेजियस होता है कि फैमिली मेंबर्स में बहुत ज्यादा स्प्रेड होता है, तो किसी को भी अगर फंगल इन्फेक्शन हो तो उनको प्रॉपरली ट्रीट करना जरूरी है. ऐसा नहीं कि हम लोग ट्रीटमेंट ले रहे हैं, वी आर कंप्लीटिंग द कोर्स, बट और किसी को है उससे भी हमें फिर से इन्फेक्शन हो रहा है, फिर हमें लगता है कि हमारा क्यों नहीं जा रहा है. सो जो मेंबर्स है, फैमिली मेंबर्स, अगर उनको भी है, बेसिकली ये बहुत क्लोज एरिया में या फोल्ड्स में रहता है, तो पीपल में फील शाय कि नहीं मैं डॉक्टर के पास कैसे जाऊं और कैसे दिखाऊं. लेकिन यू आर आपका खुद का भी बढ़ रहा है और आप दूसरे को भी ये बीमारी दे रहे हैं, ये ऐसा है.
यस, तो अगर आपको फंगल इन्फेक्शन है तो आपको अपने साथ साथ अपने आसपास के लोगों का भी ख्याल रखना है, और बिकॉज दैट इज इम्पोर्टेंट, एज डॉक्टर अरुणा हैड मेंशन्ड दैट इट कैन डेफिनेटली स्प्रेड फ्रॉम वन पर्सन टू अनदर. Doctor, we have some more live viewers question here. There's Jeet asking, is there any way to boost my immune system to reduce the risk of fungal infections during the rainy season?
Yeah, okay. Basically, what you can do, these are basically superficial infection. Okay, and likewise, I say कि skin के ऊपर रहता है, and we are giving a chance to them to invade your skin. Basically, blood में बहुत सारे पेशेंट ऐसे पूछते हैं कि मेरे ब्लड में कुछ खराबी है या मेरे खून में कुछ खराबी है, तो मुझे ब्लड टेस्ट करवाने हैं क्या. तो बेसिकली डायबिटिक पेशेंट जो होते हैं जिनका थोड़ा रेस्ट BSL उनमें ज्यादा रिकरेंसी हम देखते हैं, लेकिन इसमें बाकी ऐसा कुछ नहीं है कि जिसके लिए कुछ आपको वैक्सीनेशन लेना पड़े या नहीं लेना पड़ेगा, क्योंकि दिस इज ऑन योर स्किन, दिस इज अ सुपरफिशियल इन्फेक्शन. तो इसमें डायरेक्टली बॉडी या डायरेक्टली ब्लड जो होता है उसमें कोई कनेक्शन नहीं है. सो व्हाट यू कैन डू, मेंटेन अ हाइजीन एंड कीप अ एरियाज ड्राई, सो इटसेल्फ विल टेक care of them.
ओके सो आप कोशिश करिए कि आप ज्यादा से ज्यादा अपने आप को ड्राई रखें ऐसे क्लाइमेट में एंड refer to a dermatologist. We are saying it again and again because we definitely care for you. So refer to a dermatologist if you see any such kind of infection. Doctor, there is another viewer question. Jalankar is here and asking, ma'am, please recommend any body wash for 3 to 4 patients in family so they don't spread to family members.
So basically I can't take brand names actually, but yeah, there is a you have in a pharmacist or कहीं पे भी आप जाओगे तो वहाँ पे properly the azole containing group के body wash होते हैं. Mrs. azole containing group are basically considered as antifungal medicines. तो वो देखिए क्योंकि बहुत सारे powders भी ऐसे होते हैं, उसमें combination भी होता है. So check it contains azole kind of thing and just check it with the dermatologist कि नहीं ये ठीक है कि नहीं मेरे लिए. Yeah, but you can get it very easily. They are available to the chemist also, but after a prescription, the dermatologist.
Okay, so after the prescription, you can definitely use that particular body wash, which contains the particular ingredient which can help you reduce fungal infection. Doctor, is it like that when we are talking about body wash? Is it like that, the body wash or the soaps we use can, if they are different people in family members, so they have to use like a different soaps because it can also, if somebody is having fungal infection, the using of their soaps or using of their body wash can definitely spread the fungal infection from one person to another.
The basically obsessed human already the path is there. So from the soap easily, because in same family the large family members are there and they are using the same soap. So yes, person to person they may infect the fungal to one person to another.
Okay, so there should be different kind of soaps for people. If you are someone having fungal infection, they should properly take care of all these things. The towels, the body wash, or the soaps which they are using should not be used by other person because fungal infection can definitely spread. Doctor, we have another viewer, Suhana, and asking, क्या टीकाकरण से fungal infection यानी कि संक्रमण को रोका जा सकता है?
Already I said कि this is basically superficial fungal infection. तो जो भी है स्किन के ऊपर है तो with टीकाकरण or something like that we can't avoid that. So because हमने देखा है कि अभी कोविड एरिया में जितने ज्यादा लोगों को कोविड है उतने ज्यादा लोगों को as भी ह्यूमिड कंडीशन के ड्यू टू 1 to 1.5 लाख के पीपल को बहुत सारे लोगों को फंगल इन्फेक्शन भी हो रहा है. तो ऐसा नहीं कि बहुत ऐसा है कि ये क्लोज एरिया पे और रहता है तो पेशेंट में फील शाय कि नहीं मैं डॉक्टर के पास कैसे जाऊँ या किसी के पास कैसे जाऊँ. So they are approaching a pharmacist or somewhere or they are or through the online platform also they are purchasing the medicines. But yes तो उसका proper skin analysis करना बहुत ज्यादा important है. तो vaccination can't be there actually because it's a superficial.
Okay, so it is very important that you identify that. Doctor, is it like that there are types of fungal infection? Someone can have this particular type or this particular type. Is it like that, or fungal infection is the as you have already told a ring-like structure?
The morphology will be the same, but depending upon the location, they can be different. Like you heard of jockey itch, basically in the folds of thighs or in inguinal area, they are called as jockey itch. In between the fingers, the people who are working in very wet areas or fissures, they are basically get the fungal infection in between the fingers or in between the toes. The tinea barbi is there. So basically beard, they got such kind of infection all over the body. If they are getting a patches, they are called as tinea corporis. In the inguinal region, they are called as tinea cruris.
So there can be different type of fungal infection depending on how much area is exposed from the body, which is usually wet or which is usually humid, and where the fungus can actually make it home. That is important. Doctor, you have already mentioned that a follow up is very necessary when someone is having a proper treatment. But sometimes people actually see that the fungal infection is gone, the itchiness is gone, the round round rash is gone, or the ring-like structure is gone, they stop using the medicines. What is your advice to all those people who actually don't take full medicine, and then the fungal infection occur again, and then they are not well, and they find out that why it is happening to me again and again?
या बेसिकली आई एडवाइस टू द पेशेंट कि अगर आप फर्स्ट विजिट के लिए भी आ रहे हो तो यू शुड कैरी प्रिस्क्रिप्शन विथ यू, क्योंकि प्रीवियसली उनको क्या दिया गया है, क्योंकि दे आर जस्ट डूइंग कि ये डॉक्टर के पास गए, मेरे रिजल्ट नहीं आ रहे, उनके पास गए, उनके पास आए, लेकिन बेसिक स्किन एनालिसिस क्या किया है और डायग्नोसिस वेरी वेरी इंपॉर्टेंट। तो इसके लिए जब अगर किसी के पास आप फर्स्ट विजिट भी कर रहे हो तो यू शुड कैरी प्रिस्क्रिप्शन विथ यू, ताकि वो समझ ले कि पहले क्या क्या पेशेंट ने यूज किया। जैसे मैंने बोला कि स्टेरॉइड या ओवर द काउंटर या ऐसे पाउडर जो कॉम्बिनेशन है स्टेरॉइड एंड अजल्स का, तो वो सब यूज करके ना तो उसका मॉर्फोलॉजी पूरा चेंज हुआ होता है। तो बेसिकली वो भी बहुत ज्यादा इंपॉर्टेंट है। एंड ऑल्सो द होम रेमेडीज भी ट्राई करते हैं, कुछ कैलाश जीवन या ये सब भी यूज करते हैं। तो उसके बाद फिर बहुत डिफिकल्ट हो जाता है डर्मेटोलॉजिस्ट को कि ये बेसिकली क्या था और पेशेंट ने क्या क्या यूज किया है। Okay, and yeah, the duration of the treatment will be from 3 weeks to 3 months. And like कि आपको फर्स्ट वीक में भी बहुत ज्यादा अच्छे से रिलीफ मिल जाता है, तो आपको लगता है कि नहीं नहीं मेरा तो खत्म हो गया, बट इससे क्या होता है कि जो सिम्टम्स है, जो रैशेस है, वो कम लगने लगते हैं। लेकिन वो कंप्लीटली जाने के लिए यू हैव टू कंप्लीट द कोर्स फॉर द given duration of the time. And recurrence is very very important in such cases कि पेशेंट जब आधे में ट्रीटमेंट छोड़ देता है, बहुत सारे केसेस में हम रेजिस्टेंस भी देखते हैं कि पेशेंट आर जस्ट जंपिंग फ्रॉम दिस मेडिसिन टू दैट मेडिसिन, और जिसके कारण कि बहुत सारे पेशेंट्स को रेजिस्टेंस भी फील करना होता है, क्योंकि वो पर्टिकुलर ड्रग्स के अगेंस्ट भी रेजिस्टेंस बैठता है कि पेशेंट नहीं ले रहे प्रॉपरली, उनका कोर्स ही कंप्लीट नहीं कर रहे। तो या फॉलोअप इज वेरी वेरी नेसेसरी जब फॉर द पीरियड ऑफ टाइम की जैसे डॉक्टर ने बोला है कि नहीं अगला विजिट कब होगा। बहुत सारे पेशेंट में पल्स थेरेपी रहती है कि मंथली हम पेशेंट को डोसेस देते हैं कि हर मंथ में कितने टाइम के लिए लेना है, कितने डेज के लिए लेना है, तो वो भी एक अलग थेरेपी रहती है। तो डिपेंडिंग अपॉन योर सिम्टम, डिपेंडिंग अपॉन योर कैसा फंगल इन्फेक्शन है, कौन सी स्टेज का है, तो वी विल डिसाइड अकॉर्डिंगली। सो यस, प्लीज कैरी योर प्रिस्क्रिप्शन फॉर द फर्स्ट विजिट आल्सो एंड फॉर द the follow-up visits.
Right, carry your prescription and do tell your history about the fungal infection, that if you have tried the home remedy or if you have tried any sort of medications, you should definitely treat to your dermatologist. And as the doctor already said, that the recurrence chances are more if you do not treat your fungal infection well. Doctor, we have discussed about steroids, but there's a question from our viewer Prasad asking, are there any use of steroids in fungal infection?
No sir, the steroids का यूज नहीं है। बाकी अदर देन द फंगल इन्फेक्शन if you are टॉकिंग की नहीं, बाकी स्किन कंडीशन में जैसे मैंने प्रीवियसली मेंशन किया है कि वहां पे हमें फंगल स्टेरॉइड क्रीम्स या ओरल स्टेरॉइड देने पड़ते हैं। लेकिन इन केस ऑफ फंगल इन्फेक्शन इस antifungals may play a very important and major role. So please don't use a steroid cream for that. It will give a relief for a very short time period कि नहीं मुझे तो पूरा गया, लेकिन उसके साथ स्टेरॉइड के जो साइड इफेक्ट्स है वो भी आपको देखने मिलेंगे कि वहां पे रिंकल्स आ गए या स्किन बहुत थिन हो गया है या स्किन वाइट भी पड़ गया है और स्किन की वो डेलिकेट हो गया है, तो वो सच उसके साइड इफेक्ट्स अलग से आपको देखने पड़ेंगे। इन्फेक्शन तो जाएगा नहीं, गया तो भी टेम्पररी जाएगा, और उसके साइड इफेक्ट्स भी आपको देखने।
Right. So for fungal infection, basically, steroids is not recommendable because there are many chances of it. Doctor, when we are talking about fungal infection, are there any risk factors which are involved of fungal infection if we do not treat them? Because sometimes it is like that, for 3-4 days, people are having fungal infection, they do not treat it, and the fungal infection is gone, and then they reoccur. So they do not treat it. Sometimes people do not treat it. So are any very risk factors which are involved if somebody do not treat their fungal infection well?
बेसिकली द फंगल इन्फेक्शन इटसेल्फ इज अ कॉन्टेजियस। ओके, तो अगर आप अच्छे से नहीं ट्रीटमेंट लोगे तो और 4 लोगों को आप वो स्प्रेड कर रहे हो, तो बेसिकली दिस इज वेरी एंड इट विल कन्वर्ट इनटू द एपिडेमिक। ऑलरेडी इट इज कंसिडर एज एपिडेमिक इन इंडिया, क्योंकि बहुत सारे कम्युनिटीज को या बहुत सारे पीपल को या सेम फैमिली में हो या सेम ग्रुप्स में हो, पूरे गांव में हो, तो बहुत ज्यादा पेशेंट्स को ये इजीली स्प्रेड होता है। तो आप खुद का भी इन्फेक्शन नहीं ठीक कर रहे हो, लेकिन और किसी को भी आप स्प्रेड कर रहे हो। और बेसिकली जो इम्यूनो कॉम्प्रोमाइज स्टेटस होते हैं, जैसे प्रेगनेंसी हो गया, जैसे चिल्ड्रंस हो गए या ओल्डर एज हो गए, जो पीपल इज हैविंग सम वायरल इन्फेक्शन और सम पीपल आर हैविंग द डायबिटीज, तो उनमें ऐसा है कि ऑलरेडी उनमें थोड़ा सा हम ओरल टैबलेट्स और इसमें प्रेगनेंसी में नहीं दे सकते ज्यादातर, तो फिर वो है कि हम खुद का भी नहीं ठीक कर रहे और उनका भी बहुत ज्यादा स्प्रेड हो रहा है। सो इनमें उनको बहुत ज्यादा उसका इफेक्ट हो जाएगा। तो इसीलिए ऐसा है कि इम्यूनो कॉम्प्रोमाइज पेशेंट को हम इजीली ट्रांसमिट अगर कर रहे हैं तो उनके लिए वो बहुत ज्यादा डिफिकल्ट हो सकता है। तो इसीलिए ऐसा है कि you have to treat properly and complete the course to avoid a recurrence and the resistance.
राइट, सो ट्रीट देम वेल बिकॉज आप रिस्क फैक्टर अपने आप के लिए और अपने आसपास के लोगों के लिए भी बढ़ा रहे हैं अगर आप फंगल इन्फेक्शन को अच्छे से प्रॉपर्ली ट्रीट नहीं करते हैं। एंड डू रिफर टू अ डर्मेटोलॉजिस्ट इफ यू आर हैविंग एनी सच काइंड ऑफ फंगल इन्फेक्शन। वी आर मेंशनिंग इट अगेन एंड अगेन बिकॉज it is important to treat the fungal infection well. Doctor, sometimes using a lot of some other types of cream, so are there any specific containing or as you have already mentioned about the body wash, no? that this ingredient should be in that body wash. Is it like that some face wash or some kind of creams or powder which are available for the fungal infection? If somebody is having fungal infection, should use that particular ingredient, and what are the cream should we do not use when we are having fungal infection?
Yeah, so in case of fungal infection, basically it's a fungal infection, so you have to use an antifungal drugs. तो antifungal drugs में फॉर्मुलेशन बहुत है, जैसे टॉपिकल क्रीम्स हो गए, ओरल टैबलेट्स हो गए, ओरल टैबलेट्स में भी वेरिएशंस है। फिर उसके साथ हम सोप यूज कर सकते हैं, तो उसमें भी अजोल कंटेनिंग ड्रग्स होते हैं जो एंटीफंगस रहते हैं, पाउडर्स रहते हैं। तो दीज आर द डिफरेंट फॉर्मुलेशंस एंड बेसिकली इन क्रीम्स, इफ यू आर टॉकिंग अबाउट द क्रीम्स, cream should be applied properly. So we are advised patient to use the creams 2 centimeter beyond the margin, because the active borders of fungal infections are there and they are easily get spreading through the borders. So what we can do, so we are applying the creams 2 centimeter beyond the margin of fungal infection to protect a normal skin, and we have to apply cream from outwards to inwards. Okay, so this is very important in case of application of cream. And yes, don't use the steroid containing creams or the combination creams, they are with the antifungus and the steroids and something like that. So only use azole group of drugs and prescribe of the dermatologist.
So prescribed by dermatologist, and ozone, as the doctor already mentioned, that particular cream should be used. Doctor, what is the duration of the treatment of fungal infection? Is it like 1 year, half month, or what is the duration of basically the treatment of fungal infection?
Yeah, if a patient is treating in active stage only, so 3 weeks to 3 months they can vary. So you have to complete the proper course. बहुत सारे पेशेंट ऐसे बोलते कि 1.5 साल तक नहीं गया है, 2 साल तक नहीं गया है, इसका मतलब क्या है कि दे आर नॉट कंप्लीटिंग द प्रॉपर कोर्स, एंड सो इनके केस में रिकरेंस भी आ रहा है और रेजिस्टेंस भी आ रहा है, क्योंकि आप प्रॉपरली ट्रीटमेंट नहीं ले रहे हो तो वो ड्रग्स के अगेंस्ट रेजिस्टेंस भी बॉडी करती है। तो फिर क्या होता है कि प्रॉपर ट्रीटमेंट करना जरूरी है। तो 3 weeks to 3 months द ड्यूरेशन में वेरी डिपेंडिंग अपॉन द कंडीशन ऑफ द पेशेंट ऑल्सो। मैंने जैसे बोला कि डायबिटिक पेशेंट को थोड़ा ज्यादा टाइम लगता है, उनमें ज्यादा रिकरेंसी वगैरह होता है। तो या दिस इज द ड्यूरेशन ऑफ द ट्रीटमेंट।
Okay, so it depends on people to people how much from when they are having fungal infection. It depends on that, and do refer to a dermatologist. Doctor, any general advice you would definitely like to give to all our viewers who are watching this live?
Yeah, so please go to the dermatologist, get your skin properly analyzed, and please prescription जो है जो डॉक्टर ने दिया है, डर्मेटोलॉजिस्ट ने दिया है, वही कंप्लीट करो। कंप्लीट द कोर्स ऑफ ड्यूरेशन, और उसके बाद भी जब आपके डॉक्टर ने आपको फॉलो बोला है तभी जाके आपको उनको दिखाना बहुत जरूरी है। ऐसा नहीं कि अभी मेरा गया है तो मैं क्यों जाऊँ, या ठीक है मैं सेम प्रिस्क्रिप्शन ही रिपीट करता हूँ। बहुत सारे टाइम पे मैं ऐसा ऐसा होता है कि एक्टिव जो इन्फेक्शन होते हैं उसके लिए कुछ ग्रुप ऑफ ड्रग्स हम यूज करते हैं, उसके बाद मेंटेनेंस के लिए कुछ और यूज करते हैं, और इन बिटवीन दैट हाइजीन इज वेरी वेरी इंपॉर्टेंट. सो कीप अ एरिया ड्राई and wear a light clothes, and yeah, maintain yourself with proper hygiene, and yeah.
Yes, maintaining proper hygiene, wearing loose clothes, and taking good care of yourself. Doctor, are there any dietary precautions which someone should definitely take if he or she is having fungal infection?
Yeah, actually diet is not playing a major role, but patient is having lots of itching and scratching. So generally we advise patient कि थोड़ा सा बहुत ज़्यादा thick खाया, spicy मत खाओ. Already you are very irritated with the itching, and so it may aggravate the thing. So मैं उसमें ज़्यादा नहीं है. So you have to maintain a hydration. It's very important.
Okay, so maintaining hydration is important if you are having fungal infection. Before we end this very informative session, Doctor, any takeaway message you would like to give to all our viewers?
Yeah, the message already you know. Please keep healthy, please keep hygienic, and yeah, go to the dermatologist and complete the course. Please don't use over-the-counter medicine. They may cause harm to you. And yeah, for a proper relief and immediate relief, go to the dermatologist, and yeah, stay healthy and stay safe.
Yes, so do not self-medicate. That is the thing we are here. Dr. Aruna have already told that do not self-medicate, and if you are having any kind of fungal infection, do go to a dermatologist because it is very important. And thank you so much, Dr. Aruna Pawar Suryavanshi, for your valuable time, and it has been a really very, very quite informative session for all our viewers.
Yeah, thank you so much.
And Doctor, we really look forward for many more such sessions in the coming time with you.
Yeah, yes.
And thank you to all the viewers for an excellent participation. And for now, you know that if you have fungal infection, you do not have to self-medicate yourself. You have to go and refer to a nearby dermatologist because it is very important. Thank you, viewers, for excellent participation. And for more information and updates on skin health and care, stay connected on our Facebook page. That is All About Skin Wellbeing. We are also available on YouTube, Twitter, Instagram. Thank you and good day to all.